Yes, good morning. It's a question to OCHA, to Jens, on the upcoming pledging conference for Yemen and Saudi Arabia on the 2nd of June. I was wondering whether Saudi Arabia is the right host for a pledging conference, given its track record of war crimes and crimes against humanity in Yemen. I quote from an expert briefing of the United Nations from August 2018. The report notes that coalition airstrikes have caused most direct civilian casualties. The airstrikes have hit residential areas, markets, funerals, weddings, detention facilities, civilian boats, and even medical facilities.
Jens.
Yes, thank you, Jan. The Kingdom of Saudi Arabia has been by far the largest humanitarian donor in Yemen last year and the year before. As you know, they gave very large amounts of money. They gave it unconditionally, no strings attached. They gave it early in the year. They front-loaded it, which is what we need in humanitarian response. And partly through these very large amounts of money provided by KSA, we were able to avert the worst of a cholera pandemic. We were able to beat back a looming famine in many places in Yemen. And we were able to implement what is, in effect, the largest humanitarian operation in the world. I think KSA, with the UN, which will be the two co-hosts for the pledging conference on the 2nd of June, which is a virtual event. You will hear more about it next week when we get all the practical details together, is a normal choice based on that background.
Thank you.
I'm sorry. Part of your question, it is also true and the case, as you mentioned, that all the fighting parties in Yemen, including the kingdom, have been addressed in terms of the way that fighting has been conducted. I think OCHA and others from the UN system over the years have pointed out forcefully and vocally when that has happened. Whenever we have information that is reliable to that effect, we have raised consistently the need for adherence to international humanitarian law, which, as you all know very well, prohibits any kind of targeting of health facilities, and the fact that all civilian infrastructure and of course all civilians must be protected from the effects of the fighting. So I think we have certainly raised our voice. It is important to make the distinction that the event, the high-level pledging event on the 2nd of June, is a strictly humanitarian event. We are urging the donors to pledge generously, and those who have given indication of pledges to actually pay early, because the operation in Yemen is severely underfunded. And we are looking at about 3/4 of the programs which may close or significantly reduce in the coming weeks if we do not get an urgent injection of funds. That is an operation that reaches some 14 million people every month in Yemen. So it's critical that the funding comes forward next week. As I mentioned, you'll hear more about that. Thank you.
Thank you very much. So the next question is from Lisa.
Good morning. This is also for you, Jens. Good morning to you. I have a few short questions, but you might want to note them. Do you have figures in terms of the number of cases and deaths in Yemen so far, and if there's been any extrapolation on how serious this epidemic can get in Yemen? Then I'd like to know whether there are any provisions for taking care of any of these people, or whether they're just completely hopeless. They get sick and that's it, and they die. And then lastly, you still have aid workers there. They are, I would imagine, in extreme danger. Is there any way to protect them? Some of the staff has left, you say, on a rotating basis. If you could elaborate upon that. Thank you.
So I guess both can answer. I'll start with Fadela.
Sorry, I lost you. Okay, I'm here.
You're back.
Let me check on Yemen, because I know that we have several information on the situation in Yemen and other countries affected by emergencies. I don't
Fadela.
have in front of me. Sorry.
Sorry, no, I was going to give the figures that we had yesterday on Yemen, but go ahead.
Yes. So let me just check, and I hope to revert back to you before the end of the briefing and be able to give you more information. So let me check while we are talking.
Lisa, what I can tell you already is that yesterday the UN spokesperson at the noon briefing said that epidemiologists estimated the virus could spread faster, more widely, and with deadlier consequences in Yemen than in many other countries, as Jens said. And he gave the official figures, which stand at 184 cases and 30 deaths as of yesterday, although actual incidence is almost certainly much higher and tests remain in short supply. This is the information he gave yesterday. I don't know, Jens, would you like to add anything? Just nod if it's the case. Oh, go ahead.
Yeah, just to add, of course, the WHO will give you the officially reported figures, and that's very important. But I want to just address that, or to say that we are certainly also hearing from many of the organizations working on the ground, be it United Nations or NGOs. There's a lot of NGOs, both international and local, working on the health response, and also on the response in, for example, water and sanitation, which is critical. To be able to wash your hands, you need to have water and sanitation and soap. We hear from many of them that Yemen is really on the brink right now. The situation is extremely alarming. They are talking about that the health system has in effect collapsed. They are talking about having to turn people away because they do not have enough oxygen. They do not have enough personal protective equipment. That the numbers that are officially reported are important, but as I said, we are working on the assumption that there is already widespread communal transmissions going on. It is very, very critical that the international community steps up now and at the pledging conference on the 2nd of June, because we are heading towards a fiscal cliff. If we do not get the money coming in, the programs that are keeping people alive and are very much essential to fight back against COVID will have to close. And then the world will have to witness what happens in a country without a functioning health system battling COVID-19. And I do not think the world wants to see that. So we are raising the alarm. It is very serious. And we are getting very, very troubling reports from the field.
Thank you,
in
Jens.
terms of aid workers in Yemen, there are rotations which are come back. As I just mentioned, there was an inbound flight with international workers coming into Yemen yesterday. The vast majority of aid workers are Yemeni nationals who are working in their communities where they do have access, and they're doing a fantastic job. There are, of course, international staff still in Yemen, both in the north and in the south. Those who are not able, for whatever reason, to work physically in Yemen continues to work remotely on implementing the programs in Yemen. Thank you.
Thank you, Jens. Lisa, you wanted to add something?
Yes, just a quick follow-up. Jens, first of all, how much money will you be appealing for on this June 2nd pledging conference? And how much money do you have now? I mean, before you spoke about, and others too, that is, you're going to have to close up shop. I mean, this sounds really absolutely horrific. So how much money do you have and how much do you need? Thank you.
Jens.
Okay, without having verified the numbers, the issue is we don't have any money right now. For the remainder of the year, we estimate that we will be appealing for $2 billion between now and the end of the year. Like with any other pledging conference, the $2 billion is not the target. We never have targets for pledging at pledging conferences. Why? Because it is not funding does not begin or end with a pledging conference. Fundraising is already ongoing. Some pledges have come in, some money have come in, and I will check the exact numbers and share with you. And fundraising will certainly continue after the pledging conference. But what we will need to maintain the operation for the remainder of the year is in the vicinity of $2 billion.
Thank you, Jens.